Thank you, Mark. I think I'd also like to acknowledge not only Mark's comments there tonight, which are always very pertinent, but also acknowledge the significant commitment that AstraZeneca in fact makes to improve their pharmacy practice. Mark alluded to their interest in that area and their support for the award tonight, which is another reflection of that interest. So, to the winner, who's going to take you through a little bit of background of what the winner has done. The innovative practice of this year's award winner is in the area of pain management and involves 3 separate initiatives. First of these was the development of an evidence-based education program for nurses in the form of a 4-part DVD series entitled The Management of Chronic Pain, a Nursing Perspective, which is now being used by nurses throughout Australia. The second initiative was the development, in collaboration with Pain Australia and others, of the Mackay Queensland Pain Support Group. This is a unique multidisciplinary treatment and education program for patients in regional Australia, facilitating access to self-management support programs. The third string in the bow was the initiation and subsequent implementation of the Persistent Pain Project, run by the Gold Coast Medicare Local. This project seeks to optimise access to primary healthcare services within the Medicare Local framework for all patients suffering persistent pain. Any one of these initiatives and innovations would be worthy of consideration for this award. However, taken together, they form a compelling case. So, without further ado, the worthy winner of the 2013 AstraZeneca Innovative Pharmacist of the Year is Joyce McSwan. I'm going to invite Joyce to say a few words.
Go, Joyce.
Wow, thank you so much. Normally I have lots to say, for those who know me. I'm just a little bit nervous and a bit sort of overwhelmed, really. Look, thank you so much for this incredible privilege of being able to serve pharmacy and to be able to serve those who live with persistent pain. Thank you, AstraZeneca, for this very generous award, because it's really through initiatives like this, initiatives like what UTS is doing and will do, that inspires the profession on. In hearing all the things tonight that UTS is doing, all I can say to the general pharmacists out there is watch out. And so I think that's very much a wonderful thing, and it inspires me daily. There's so many people to thank, and I'd really like to acknowledge them publicly here if I can. I'd really like to thank Pain Australia, to the Australian Pain Management Association, to Gold Coast Medicare Locals, to Pharmaceutical Society of Australia. Those people have been able to have worked together so hard and have sort of allowed me the opportunity to create models of care, clinical pathways for people who live with persistent pain. Most importantly, I want to thank those patients who have allowed me the opportunity to travel on this journey with them. And it really is a privilege as clinicians to be allowed that journey with them, because they don't have to, and yet they have to put so much trust in us. Obviously to my very patient husband, who sometimes wonder why. However, his long suffering and patience and inspiration has been just absolutely amazing. And currently to my clinical family, Dr. Ray Shah and Dr. Ken Cameron, who are just such fun to work with, and we collaborate so well. And it's one of those areas where within the bridge of medical professions that we continue to talk and help our sometimes overwhelmed colleagues in this space of pain management. So while I work in pain management, and it has certainly found me, certainly deals with general medicine in many cases as well. Just to be allowed the opportunity perhaps to just raise the awareness of the degree of issue pain management is such a gap. 1 in 5 patients suffer persistent pain, with 80% of patients currently missing out on pain treatment. And the recent statistics that came out showed that 50% of those who leave work, are forced to leave work because of their disability between 45 and 65 years old, will be in poverty. So those are really urgent gaps for us to fill as pharmacists, and certainly programs as Warwick mentioned that I've had the privilege of innovating is meeting some of this. So for the students, if I can sort of leave you with one thing, and I recall not so long ago, checking the white hairs, but not so long ago, I was in your seats, and it's just so wonderful to be there where you are for this world ahead. And if I can just leave you one thing, and that is to be very passionate, to believe that you can learn anything, and to also make sure that whatever you say you will do, that you do, and to add that special zing with whatever you do. It really is very special for the patient, it really is just what money can sometimes not buy. So with that, well done to the students. Thank you very much for this, and I look forward to more innovations.
Congratulations again, and thank you, Joyce, for that. And I'm sure it is an inspiring story, and I think we're going to read about it further in the Australian Journal of Pharmacy in the not too distant future, and hopefully it will inspire other pharmacists in this very, I think, important category for pharmacy of the future, which is pain management. It's one of our leading 3 categories in over-the-counter therapies, and I think it's an important area where we're going to see more action from pharmacists in the future. So thank you, and that finishes our formalities for the night. Thank you all for being with us and being part of tonight's ceremonies. I hope you've enjoyed yourselves. There's still plenty of networking and coffee and other things to do. We look forward to this event again next year, and hopefully you'll all be along again. But thank you very much.